Hello everyone and welcome. Dr. Sakamoto here. This time, we will be discussing cervical disc herniation and lumbar disc herniation, commonly known as neck and lower back herniated discs. I would like to talk about the innovative and promising field of stem cell therapy for various conditions that damage the spinal nerves, such as lumbar spinal stenosis and cervical spondylotic myelopathy. In the field of orthopedics, a significant number of people suffer from conditions like stiff shoulders and lower back pain. Among these, a lumbar disc herniation or a cervical disc herniation can cause lower back pain, shoulder stiffness, and numbness in hands or feet. Additionally, there may be a decrease in hand strength or muscle loss in the legs. Additionally, symptoms such as difficulty using chopsticks can arise from cervical disc herniation and lumbar disc herniation. Under current insurance-based medical care, if the condition worsens, surgery is the option. In the past, I also performed surgeries under insurance coverage, but even after surgery, some patients still experienced hand numbness or couldn't fully regain strength in their legs. Even with modern medical advancements, it is quite challenging to treat these issues. Nerve numbness, in particular, is indeed quite difficult to treat. Recently, medications for numbness such as these have become available, but they do not completely eliminate all numbness. In such cases, where doctors have said that there's nothing more they can do for numbness or muscle weakness, a significant number of patients have indeed actually remarkably recovered with stem cell therapy. By directly injecting stem cells into the spinal cord, I have witnessed many cases where numbness and muscle weakness that could not be fully addressed by surgery have significantly improved. With traditional treatments, if surgery didn't work, we had no choice but to monitor the condition as a permanent after effect. With stem cell therapy, issues such as severe numbness that prevents sleep or weakened leg strength that makes it difficult to walk for long periods can be addressed. When I see people who found it difficult to even go downstairs significantly recover and feel happy thanks to stem cell therapy administered into the spinal cord, I always think that this cutting-edge regenerative medicine is truly amazing. Now, I would basically like to explain the actual stem cell therapy for disc herniation. This patient is a 50-year-old man. Although there wasn't any significant cause, he suddenly started experiencing back pain. After that, his leg muscles weakened, making it difficult for him to walk. A detailed examination at the hospital revealed a thoracic disc herniation, and he underwent surgery immediately afterward. In cases of disc herniation, if muscle strength in legs or hands starts to decline, immediate surgery is often necessary to prevent permanent damage. Thus, emergency surgery is frequently performed in such situations. This patient had a thoracic disc herniation removed, followed by a fusion surgery to stabilize the bones. However, even after the surgery, the muscle strength in his legs did not fully return, and he still experienced difficulty walking long distances. Originally, there was no numbness, but after the surgery, numbness in the legs was observed. In surgeries for the neck or lower back, such as these delicate procedures, the surgeon has to carefully maneuver around major spinal nerves while removing and precisely extracting the disc, which can sometimes cause minor nerve damage. Sometimes, symptoms such as numbness that wasn't present before the surgery or a slight decrease in muscle strength can occur. When performing surgery for disc herniation, there are always risks of complications. When stem cells were administered into the spinal cord of this patient, which was a critical step, the leg numbness that appeared after the surgery completely and miraculously disappeared. About the muscle weakness in the legs, after the administration of stem cells, the muscle strength completely returned to normal. However, there seemed to be a slight tightness remaining in his left leg, but he had no issues with long-distance walking and could even jump on one leg without any problems. He was very pleased to have almost fully recovered. As such, Stem cell therapy that involves injecting cells into the spinal cord is rarely performed in our country. In this way, even after undergoing surgery for the neck or lower back, stem cell therapy is considered highly effective for residual numbness, pain, and muscle weakness as post-surgical sequelae. This time, I explained the administration of stem cells within the spinal cord. Detailed explanations of the case studies mentioned in this video are available on our website, which you can access through the link in the description. If you found this video really very helpful, please hit the like button and subscribe to our channel. Thank you very much.